Introduction to diabetes mellitus is a metabolic disorder in which a person's blood sugar levels become too high. The body's inability to produce or use insulin leads to the accumulation of sugar in the blood. Diabetes mellitus is a major health problem all over the world, and its prevalence is increasing. The disease can lead to a number of serious health complications, including heart disease, stroke, blindness, kidney failure, and amputations. There are three types of diabetes mellitus: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system attacks and destroys the cells in the pancreas that produce insulin. Insulin is a hormone that helps the body use sugar for energy. People with type 1 diabetes must take insulin injections to regulate their blood sugar levels. Type 2 diabetes is the most common type of diabetes, and type is caused by a combination of factors, including genetics and lifestyle choices. People with type 2 diabetes can usually control their blood sugar levels by making healthy lifestyle changes, such as eating a healthy diet and getting regular exercise. However, some people with type 2 diabetes also need to take insulin injections or oral medications to help control their blood sugar levels. Gestational diabetes is a type of diabetes that occurs during pregnancy. Gestational diabetes usually goes away after the baby is born, but women who have had gestational diabetes are at increased risk for developing type 2 diabetes later in life. There are many things you can do to prevent or delay the onset of diabetes mellitus. Some of the most important steps are to eat a healthy diet, get regular exercise, and maintain a healthy weight. You can also reduce your risk of developing diabetes by quitting smoking and avoiding excessive alcohol. Pathophysiology of diabetes mellitus. Gestational diabetes is diabetes that is diagnosed during pregnancy. It is caused by the hormones of pregnancy that block the action of the mother's own insulin. This causes the blood sugar levels to become too high. Type 1 diabetes is caused by the body's inability to produce insulin. Insulin is a hormone that helps the body use glucose for energy. When the body can't produce insulin, the blood sugar levels become too high. Type 2 diabetes is caused by the body's resistance to the effects of insulin. Insulin is still able to work, but not as well as it should. This causes the blood sugar levels to become too high. Gestational diabetes usually goes away after the baby is born, but it can increase the risk for type 2 diabetes later in life. Signs and symptoms of diabetes mellitus. The signs and symptoms of diabetes mellitus can be different for each person. They can include feeling very thirsty, feeling very hungry, even if you have just eaten, urinating a lot, especially at night, having blurred vision, feeling very tired, having skin that is itchy or dry, having sores that are slow to heal, having a tingling or numbness in your feet or hands. Prevention of diabetes mellitus by diet. There is no one definitive answer to this question, as the causes of diabetes mellitus type 2 are not fully understood. Some possible factors that may contribute to the development of type 2 diabetes include genetics, obesity, lack of exercise, poor diet, certain medications. Diet plan for controlling diabetes mellitus. Some general tips that may help people with diabetes mellitus include eating regular meals and avoiding skipping meals, eating plenty of fruits and vegetables, avoiding processed foods and sugary drinks, limiting portion sizes, eating low GI foods, planning ahead to make sure you have healthy snacks on hand. Medical treatment of diabetes mellitus. There is no one definitive answer to this question, as the best medical treatment for diabetes mellitus will vary from person to person. However, some general tips that may help people with diabetes mellitus include checking blood sugar levels regularly and adjusting medication as needed, eating regular meals and avoiding skipping meals, eating plenty of fruits and vegetables, avoiding processed foods and sugary drinks, limiting portion sizes. Exercising regularly, checking blood pressure and cholesterol levels regularly. Mass control of diabetes mellitus. The most effective way to control diabetes mellitus at a population level is through education and awareness programs. These programs can help people learn about the risks and symptoms of diabetes mellitus, as well as how to best manage the condition. Additionally, public health campaigns can work to reduce the stigma associated with diabetes mellitus and make it easier for people to seek treatment.